So students, today we will discuss about porphyria, heme synthesis, blah blah blah. I mean, I'm not going to teach you any fundamentals because this is purely a MCQ channel. So anyway, first thing is that I want to let you know that heme synthesis is one of those rare pathways which occurs in both mitochondria and cytoplasm. Both mitochondria and cytoplasm. Can you tell me the other pathways which occur in both mitochondria and cytoplasm? Yes, it has a mnemonic. What is the mnemonic? The mnemonic is HUG, hug. So HUG. This both mitochondria and there are three pathways, H, U, and G. So H is what? You know, heme synthesis. What is U? U is obviously urea cycle. And G is what? Gluconeogenesis. Gluconeogenesis. Okay, gluconeogenesis. And another thing is also there. There is this pyrimidine synthesis. Usually pyrimidine synthesis is not given in the option, but okay, let's be careful and also remember this thing, hug P or something whatever. So pyrimidine synthesis. What is the rate limiting enzyme of the heme synthesis pathway? Rate limiting enzyme will be, what is RLE? RLE is allosynthetase. To make the discussion more meaningful, let me rub this information, then I will tell you. Mitochondria, cytoplasm. Which step occurs where? It will also be obvious now. So first step is what? Succinyl coenzyme A plus glycine will make succinyl coenzyme A plus glycine. It will make ALA, amino levulinic acid or ALA. What is the enzyme here? Allosynthetase. Okay. Now allosynthetase is inhibited by what? It is inhibited by INH, isoniazid. It is inhibited by OC pills. It is inhibited by glucose, and it is inhibited by heme. Remember these things, they inhibit allosynthetase. And the cofactor for allosynthetase is B6. And deficiency of allosynthetase, deficiency can lead to what? Deficiency can lead to sideroblastic anemia and X-linked protoporphyria. X-linked protoporphyria. Then what will happen? ALA will get converted to what? It will get converted to porphobilinogen. And what do you think is the enzyme here? ALA dehydratase. From ALA dehydratase, do you remember something? There is a heavy metal poisoning which leads to inhibition of ALA dehydratase, that is lead. Lead will inhibit ALA dehydratase. And if ALA dehydratase is congenitally absent, then what it is known as? It is known as ALA dehydratase deficient porphyria. Very stupid name, ALA dehydratase deficient porphyria. Okay. And what will happen from porphobilinogen? From porphobilinogen, it will become HMB. What is HMB? Hydroxymethylbilin. The enzyme is what? Enzyme is porphobilinogen. Ammonia gone out, porphobilinogen deaminase, which is also known as uroporphobilinogen 1 synthase. And what is the disease? The disease is known as AIP, acute intermittent porphyria. So what is the symptom of acute intermittent porphyria? From the word acute, what do you remember? If you have gone to your wards and you have solved clinical question, then the word acute immediately reminds you of abdominal pain. Acute, तो क्या है? Acute abdominal pain. So basically, very stupid trick, but remember, acute intermittent porphyria is acute abdominal pain. Plus, you will have neuropathy. Let me be specific, peripheral neuropathy. Okay, peripheral neuropathy. Okay, one small thing. If this enzyme is uroporphobilinogen 1 synthase, then HMB is also known as what? Uroporphobilinogen 1, isn't it? It is also known as uroporphobilinogen 1. That is why the enzyme is uroporphobilinogen 1 synthase. Okay, now HMB or uroporphobilinogen 1 will get converted to, see, this is not the exact cycle. There are some steps we are omitting because it's useless to know certain steps. So just don't ask me like where is uroporphobilinogen 2, where did it go? Anyway, so uroporphobilinogen 3. Enzyme will be uroporphobilinogen 3 synthase because you are synthesizing that, isn't it? What is the disease? The disease is congenital erythropoietic porphyria. Congenital erythropoietic porphyria. What are the symptoms? Erythro. From erythro, remember this is pink teeth. Erythro means what? Red. Okay, erythro means red, so pink teeth. And pink skin, basically photosensitivity. Photosensitivity. Pink teeth, pink skin. Okay. From uroporphobilinogen 3, we will have coproporphobilinogen 3. So what is the enzyme? Enzyme is uroporphobilinogen decarboxylase. Urode for short. And what is the disease? The disease is PCT, Porphyria cutanea tarda. So what are the symptoms of Porphyria cutanea tarda? You will have liver problems like cirrhosis. You will have fatty infiltration. Okay. Sometimes you can have chronic liver disease. So liver disease, and you will also have photosynthesis. So cutanea tarda, cutanea. So something to do with photosensitivity, and you will have pink urine, and you will have photosensitivity, and you will have blisters in the skin, and you will have pink urine. Porphyria cutanea, pink urine, Porphyria cutanea tarda. And remember, it is sporadic. See, this is sporadic. Why did I tell it is sporadic? Because all porphyrias are autosomal dominant, except 4 or 5, which are, some are autosomal recessive, some are X-linked. One is this X-linked recessive. This is one thing. This is sporadic. So what are the autosomal recessive? Okay, I am writing it in one place. All porphyrias are autosomal dominant except autosomal recessive. Who are autosomal recessive? Except what? Ala dehydratase deficiency. Ala dehydratase, this thing. Ala dehydratase deficiency is autosomal recessive. Dehydratase deficiency, CEP, congenital erythropoietic porphyria, EPP, erythropoietic protoporphyria. Okay, these are autosomal recessive. X-linked, what is X-linked? Ala synthase deficiency, sporadic. What is sporadic? PCT, Porphyria cutanea tarda. So anyway, just remember this association. Also remember that this PCT is the most common porphyria. PCT is the most common porphyria. And liver, from liver you remember that this PCT is also associated with hepatitis B, hepatitis C, and hemochromatosis. Okay. From coproporphobilinogen 3, what you will have? From here you will have protoporphyrinogen, and the enzyme will be coproporphobilinogen oxidase, and the disease is hereditary coproporphyria. No other questions. From protoporphyrinogen, what you will have? You will have protoporphyrin. And the enzyme is PBG oxidase. Now you will tell me what is PBG. You must have told ki ma'am it will be protoporphyrinogen oxidase, PBG. But listen, protoporphyrinogen is what? The same is also protoporphobilinogen. See, remember this coproporphobilinogen, it can also be written as coproporphyrinogen, because whether bilino is there or not, that bile component is there or not, does not matter. The point is it is a porphyrin. So you can casually write it as coproporphyrinogen. Similarly, protoporphobilinogen, I can also write it as protoporphobilinogen. Does not matter. Okay. So anyway, so protoporphyrin, and this enzyme is PBG oxidase, and the deficiency will lead to what? Variegate porphyria, and it will lead to skin and neuro symptoms, means peripheral neuropathy, and skin means same, photosensitivity, blisters, etc. So you see the point here, what I am trying to make. Here you will have photosensitivity, but are there any neurological symptoms in CP? No, there are not. Here you will have skin plus neuro. And in AIP, we were having abdominal pain plus neuro. So you see the thing here. Here it is abdominal pain plus neuro. Here it is only skin. Here it is skin plus neuro. In variegate, because variegate, it is having symptoms of both CEP and AIP. Therefore, it is called variegate, variety. There is a variety of symptoms. And sorry, in my flow, I forgot to do the right thing here. See, let me write it properly. Protoporphyrinogen PBG oxidase will be here, and here, what is that? protoporphyrin. Okay, means I want to tell that protoporphyrin is formed in the mitochondria. In the mitochondria, protoporphyrin is formed. Okay, from protoporphyrin you will form heme. You will form heme. What is the enzyme? Enzyme is ferrochelatase. So ferro means you need iron here, Fe2 plus, and this enzyme is also inhibited in lead poisoning. It is also inhibited in lead poisoning. And if there is a deficiency of the enzyme, congenitally deficient, then you will have EPP, erythropoietic protoporphyria. Okay, you remember EPP? EPP is an exception. All porphyria are autosomal dominant except some are autosomal recessive like EPP, CEP, aldehyde. Remember? So this is it. Okay, some other small points. Remember that in porphyria at 400 nanometer on immunofluorescence you will see something called SORT, SORT band on immunofluorescence. My battery was down, that is why I already wrote it and I'm just making it quick. Two enzymes which are defective in lead poisoning. I told you about two enzymes. Can you tell it to me together? Aldehyde and ferrochelatase. And therefore lead poisoning can present as sideroblastic anemia. Usually porphyria present as sideroblastic anemia, but lead poisoning can also present as sideroblastic anemia because it inhibits the enzymes of the heme synthesis. So see, this is a very important question and this is previous year question. They will directly ask you what are the enzymes which are inhibited in lead poisoning. So remember, this is aldehyde, not synthase. Okay, this is aldehyde. Remember this, very important. Then you have this thing, another question, heme to biliverdin, which is the enzyme? Can you tell me? Heme to biliverdin. This is heme oxygenase. Heme oxygenase. And you know what is the product of this reaction? The product is carbon monoxide. And listen, why I wanted to tell you this is because this enzyme, this particular reaction from heme to biliverdin through heme oxygenase is the only endogenous source of carbon monoxide in our body. Only endogenous source of carbon monoxide in our body. So these are two MCQ points, so I told you. And that SORT band at 400 nanometer, that is also another random MCQ. I don't think it will come again, but still. So that's our topic. Thank you.